I am very happy to address you. First, all of you should thank her, because this class has become possible because of her. See, the organizers are very particular about your mental well-being. For a week, you have been receiving heavily loaded classes from other speakers, and I think they wanted to make you happy, and they have arranged my class. I am happy with every part of my body. Yeah. Can you name a Vajikarana Dravyam that can be administered through the eye? Even before you got my question, he is giving the answer. What is the Vajikarana Dravyam that can be administered through the eye? See, we always want to succeed, and we always believe that to succeed we need lot of intelligence, lot of hard work. Yeah, those are partially correct, but more than intelligence, it is the interest that is going to carry us forward. There are many very intelligent people, and some of them are in the jail because the intelligence was not applied properly. But if you are very interested, and even with very little intelligence, your enthusiasm will take you a long distance. And Ayurvedic field is one such area where your concern for the suffering and your enthusiasm to learn will matter much more than your actual intelligence to grasp the theory of Ayurveda. What is the theory of Ayurveda? It is very simple. There are only 5 Buddhas. Whatever is more should be reduced, and whatever is less should be increased. And for the remaining 5.5 years, you are looking for signs and symptoms indicating the increase and decrease of the Buddhas, and the medicines and the means to achieve this. Am I right? Okay. But see, how do we to achieve a correction? We first have to understand what is wrong in the body, and how do we get the information? Darshana, Sparshana and Prashna. And unfortunately, we are relying more and more on Prashna, and we are relying less and less on Darshana and Sparshana. Am I right? But in veterinary science, they don't have the component of Prashna. Maybe they can talk to the owner whether the cow is taking feed or not. But the component of Prashna is very limited in veterinary science, and they rely more on Darshana and Sparshana, and probably 90% of their information comes from Darshana. But this is an area where Ayurvedic physicians are not confident, or maybe Ayurvedic physicians are not interested in this particular area, because we get more information through Prashna. But before joining Ayurveda college, I was interested in Samudrika Lakshana Shastra, and my method of observing a body was altered, and that gave me a definite advantage in observing patients and making line diagrams in my case sheet. And after some time, I started making some association with some clinical symptoms and some features on the body. And nobody taught me tongue diagnosis. I have not read any book on tongue diagnosis. I'm just there is a phenomenon or process called association in psychology. In psychology, there is a small component called association. Okay, and here I have simply associated certain features on the body with certain clinical conditions, and because most of them are fairly consistent, I have felt confident to record it in my case sheets in my clinic and college, and now I am very sure that I am not misleading the next generation. Okay, if you want, see, you don't have to learn tongue diagnosis from me. If you are interested, if you have a Sony camera, next time you are planning to buy a new mobile phone, go for a Sony mobile phone with an excellent camera, and keep on taking photographs of the tongue, the hand, and the feet, etc. And after 1 or 2 years, you will be teaching tongue diagnosis to others. It is very simple. See, the Acharya said, the Kapha produces whitish discoloration, and the Vata produces blackish grey discoloration, and the Pitta produces all other discolorations. Am I right? And Pitta produces, the Acharya says the words are exactly like this, and Pitta is capable of producing all other discolorations. Okay. So the Acharya, in the name of Yukti, has given us lot of freedom and responsibility. So if you are willing to take responsibility, you can also avail the freedom. Okay, and the tongue diagnosis is actually very easy to learn and very easy to teach. Okay, all you need is a good camera. Okay. This is how people introduce me, but this is what I want to be known as. See, do you know where this place Mangare is? You had been there? Yeah, it is a very blessed place with all the ideal features of good bhumi, slanting towards the east and north, and that was a place where a lot of learning took place, and still it is taking place. And see, you might have seen that there was no imposing infrastructure there, and the infrastructure existed only in the minds of our teachers. They were very simple people, or they convinced us they were very simple, but they made us confident, and there was a lot of discussion taking place, and there was actually no hierarchy, and the students were not afraid of the teachers. They only respected the teachers, and the teachers were very friendly, and they encouraged debate, and it was not a case of regurgitation of sloka and the meaning for 45 or 60 minutes. There sometimes the portions were incomplete, but we had no complaints, because we were getting clinically relevant information, and we were never bothered about our teachers reading up to the end of the textbook. Okay, they always were injecting the concept into us, and they would be reading a sloka, and they would be explaining it, and by the time they finished 5 or 6 slokas in the chapter, they would have conveyed the Nidhanam, Samprapti and Chikilsa, and maybe it happened in the first year itself, and also in the second and third years. So that was a place where we always felt very confident, and we always felt that we may not need any further education, or we may not need a government salary to ensure our financial security. Okay, Okay, what is Ashtasthana Pariksha? We all know. Okay, and one of it is Jihva Pariksha. Okay, but you see, we always think that what we get inside the classroom is sufficient or complete. Okay, in the unfortunate, see, in olden days they were learning from their teachers or from their fathers or grandfathers, and they took 20 or 30 years to understand this science, and naturally a very experienced physician was transferring his or her knowledge to their children or grandchildren or a very eligible disciple, and they were sharing the richest experience. There was no rigid syllabus, but at the same time now we have a very rigid syllabus, and teachers have only 4.5 years to convert you from an eager student to a confident doctor. But in this process we find that some of the information in the textbook is diluted, polluted, and there is lot of interpolation and extrapolation. So it is the duty of the students to verify what they get and also match it with what is available in the textbook and what is believed by other practitioners. See, modern medicine has lot of data, but it is not able to conceptualize. But at the same time, we are relying on a limited quantum of data, but we have a lot of concepts which are helping us to have enormous checks and balances. See, I will give you how Ayurveda has made us very efficient in making interpretations. See, in one particular research pertaining to the cardiology, they found a definite association between increased cardiac disease and increased coating on the tongue. They found that whenever the patients were more sick, they had more dirt on the tongue and also more upalepa on the teeth. And finally, one of the researchers gave an interview to the newspaper, and she said, maybe based upon the findings, we should ask the cardiac patients to brush their teeth twice daily. Can you imagine this? Can you appreciate this? They spent a lot of money, and many experienced people were involved in the science, in the study, and the research team simply concluded that people with more cardiopathy will be having more dirt on the tongue, and their only responsibility was to ask the patients to brush more vigorously. As Ayurvedic physicians, what would have been our advice? We would have connected the upalepa on the tongue and teeth to the status of the intestine, and we would have made an association with the Agni Bala and the presence of Ama with the upalepa, and naturally we would have advised Kafahara, Kledahara Dravyam like papaya, pineapple, pepper, ginger, and hot water, etc. And we would have given drugs accordingly, and we would have waited for the tongue to become clean before we administered any Guru Dravyam or Brahmana Dravyam. Okay. See, unknowingly our science has made us more resilient in making clinical interpretations. So, whenever we get a bit of information either from the textbook or from a lecture, we should try to segregate into data and concept, and data is always available in the textbook, but the concept comes through debate. See, modern medicine is always denigrating it. Many practitioners of modern medicine are constantly trying to denigrate us, and they are always insisting on evidence based medicine. But now we know that even though a member of parliament had insisted on not allowing simultaneous clinical trials, the Indian parliament somehow permitted simultaneous clinical trials, which means the drug will be simultaneously tested in the parent country and our country, but the danger is maybe they are not conducting the drug in the parent country at all, and maybe it is directly tested on Indians, because if a pig or rat or rabbit dies in Europe, somebody is answerable, but if Indians die, nobody is answerable. Okay? So, the appreciation and recognition from the Western countries comes very slowly. But our medicines have been given for several centuries, whereas many new drugs are withdrawn from the market just after 3 or 6 months. How does knowledge come from? Tada pratyaksham jnanam. Okay. So, whenever bits of information are coming, you have to observe, collect, collate, compare with similar or dissimilar data, and then confirm and interpret and apply and then confirm. When you tell something people something new, it is actually a hypothesis, but when it is established, it becomes a theory. Okay. So, every new thought or every new observation in any science has to go through these essential stages. So, in our textbook there is not much data regarding Jihva Pariksha. Okay, maybe the people who wrote those treatises did not have much need for an elaborate data that had to come from Jihva Pariksha. Okay. But we can always improve. See, these are 3 examples of how being an Ayurvedic physician is something of an advantage. Many Ayurvedic students and practitioners believe that had they been more lucky, they would have ended up in an MBBS college. Okay. But fate has been decided, and there is but wherever we are, there is always room for improvement and success. See, for example, they conducted a study in Israel, and at the end of the study, the researchers said that children in rural area have more immunity, and that is probably because of the more frequent intestinal infections they would have suffered from compared to the children in the urban area. Okay. It was a study on inflammatory bowel disease or Crohn's disease, or a disease where the component of inflammation was more. They found that the inflammatory bowel disease was more in urban children and less in rural children, and they made a connection with higher number of infections in the rural area and a greater immunity. But I think they were missing an important point. In the urban area, the children would have consumed more of processed food and produced by the manufacturers, and they naturally they might have had more of preservatives and other chemicals, which would have produced more inflammation in their intestine. See, and there are many such examples where modern medicine, after spending enormous time, effort and money, is sometimes making the wrong connection. But our own system has prepared us to make the right interpretations. I gave the example of the plague and the cardiac disease, and there is one common pathetic finding which we have to frequently encounter in our clinical practice. We know that for Vadarakta, Ahita Bhojanam and Vidaham in the Kostam is an important prelude to the manifestation of Vadarakta. Okay. And whenever there is an inflammatory bowel disease, there is something wrong with the gum and the teeth, and there is formation of tartar plaque, and the tooth becomes loose. And the modern medicine is never making a connection between the status of the intestine and the status of the joint. Instead, it is making a connection between the teeth and the joint. And in many unfortunate cases of arthritis, they have advised the patient to remove all the teeth and go for a set of artificial dentures as a cure for their arthritis. But on the other hand, when we give Deepanapachana, Aushadam and Hidabhojanam, the inflammation in the intestine comes down, and the tartar disappears. The tartar will disappear within 2 to 4 weeks. Any person who has tartar will be visiting their dentist at least once in 6 months to remove the tartar. You give Deepanapachana Aushadam, within 2 to 4 weeks all the tartar would go. It is very simple. And in many such cases of arthritis, the patients have been advised to remove all their teeth. Maybe they had just one or two loose teeth, but they were advised to remove all the teeth and go for artificial dentures in order to recover from their arthritis. But on the other hand, when we give Deepanapachana Aushadam, all the trouble inside the mouth goes off. So, after 5.5 years, we don't know everything. At the best, we have a license to kill, or when something goes wrong, we have a license to wriggle out of a difficult situation. So, whenever you are in doubt, what should you do? You can speak to experienced physicians, you can speak to your teachers in the college. What else can you do? When in doubt, stick to the basics. This is one approach or attitude which will save you throughout your life. Because in almost any successful treatment, you will always find that the physician is simply sticking to the basics, whether it is an aharam or aushadam or a selection of panchakarma. See, Vata produces Shava, Kapha produces Shvaitya, and Pitta produces probably all other discolorations. And our own textbooks are not complete. They are complete means it is not giving you all the information, it is not giving you all possible diseases, it is all giving you all possible combinations of drugs. See, according to modern medicine, arthritis is close to 200 in number. For us, it is very few, close to half a dozen. Okay, but so in Ashtanga Hridayam, in Nidana Sthanam, there are only 16 chapters, but the number of diseases can go into several hundreds. So in Ayurveda, if there is a chapter in Nidana, it is not a chapter on a single disease, but it is a chapter on a group of diseases where the cardinal symptom is common. Okay. If you can understand this simplicity in diagnosis, you can also understand that the treatment is also simple and you don't need too many combinations to become a general practitioner. See, if you become an expert, your life will become very monotonous. If you become an expert, your life will become very monotonous and you will be getting very few cases pertaining to 1 or 2 diseases, and you will be using only 20 or 30 of your very favorite drugs, and the prognosis is also a foregone conclusion, and the challenges in your life will have less spectrum. Okay. But to become all people want to become an expert in some field, but the real challenge lies in becoming a good general practitioner, because all the patients first come to a general practitioner and they go to an expert guided by the general practitioner whom they have trusted for several years. There is an important sloka. Acharyal, can you complete? Acharyal. As a student, I did not make an effort to memorize all the slokas, just few important ones. Acharyal, Padam, Adatte. Am I right? Padam Sahapadinam. There is, I have deliberately left one component, and the last component is Padam Kalakramena Cha. The Acharya says, 1/4 of your information comes to your teacher. See, the teacher is telling you that I will teach you only 1/4 of what you need to know. It is a panic situation for any interested student. Sir, if you are teaching only 1/4 of what I need to know, where will I get the remaining 3/4? The Acharya says, Padam Sahapadinam. The remaining 1/4 will come through your colleagues or peers or your classmates. Padam Sahapadinam. The third 1/4, the fourth 1/4 will not be taught by anybody. You will be learning as a component of on the job training. Okay, and it is to fill this important and a vacuum that components like Jihva Pariksha will help you a lot. Can you complete the sloka? Acharyal Padamadate. She forgot it just now. She was telling me the missing component. കാര്യം കൊണ്ട് അടുത്തപ്പോൾ ധൈര്യം സ്ലിപ്പായി. Okay, see, the textbooks have been deliberately kept simple. Okay, why? The acharyas could have given you all the symptoms they came across. They could have recorded all the combinations they made use of. You would have been simply left with confusion because of an information overload. Okay, they gave you limited data, sufficient concept, and lot of freedom and responsibility in the name of Yukti. You should be very happy. Nobody is able to complete this sloka? Padam? Yeah. Correct. See, while preparing the slide, I left a lot of dots because I could not recollect the entire sloka. See, the Acharya has given me permission to be irresponsible. The Acharya says, Na jihriyat kadachana. Don't be ashamed if you don't know the name of the disease. Okay, and so I took it as a liberty to not to know everything. So, when in doubt, we have to stick to the basics. What are the basics? What are the basics? Okay, I will help you to concentrate. What are the basics? Vata, Pitta, Kapha, before that Panchamahabhuta, before that Tanmatra. Okay. What is the theory of Ayurveda? You have only 5 Bhutas in your body. If they are in a state of equilibrium, you are healthy. If something increases, you become sick. When something becomes less, you become sick. What is treatment? Increase on what is less and decrease what is more. Okay, very simple. If it is a mild increase, you give Dipana Pachana Anulomana Dravyam. The Dushta Kapha, Dushta Pitta and Dushta Vata will be eliminated through the anus. If there is more trouble, you do Vamana, Virejana and Vasti. Okay. Even when you need Vamana, Virejana and Vasti, if the patient is not rich, if the patient is not having sufficient Agni Bala and Deha Bala and Dhana Balam, and if you don't have a Panchakarma clinic and if you have no loan from the bank, you don't have to do Panchakarma. Okay. Many people when they have a hospital, they suddenly lose their clinical skill. Whenever they see a patient, they say, oh, this is a very big disease, you have to get admitted for 40 days. Okay. Otherwise, they will do open heart surgery on the veranda. Okay. What is the basics? Very simple. Panchabaha Buddha. Okay. Increase what is less and decrease what is more. Okay. And we have this Ashtasthana Pariksha and Dashavida Pariksha, and here we are collecting information from about the disease and also about the diseased. Okay, we are collecting information about the disease as well as the disease, and when we are trying to collect information, Jihva Pariksha is a practical component. Okay, what about Nadi Mutra Malam? How much information will you collect from Malam? Okay, the information is limited, but the information from Jihva is enormous. See, in order to condition the mind, I'll show you few photographs, and you will realize how much variety or how much variation is happening on the surface of the tongue, and how much information we have allowed to go by without recording it. Okay. Now, do you want the lights to be switched off for a second? Just look at the pictures and try to observe and try to have a photographic memory of all these, and try to see if you have understood, and try to see if you are able to understand and associate something. Okay. Look at the skin on the cheek. Can you come up with a medicine? Can you tell me the dosha dominant? It is glossy. The skin on the cheekbone is glossy, and it is having ups and downs. And is it not due to Vata? Okay, what medicine will you give? And let us all assume that all the people here are in the third year of the BAMS. So if you are making a wrong suggestion, there is nothing to be ashamed of. Na jikhriyat. Okay, what medicine will you apply? Utsadana Dravyam, Goduma. Anything else? Any other suggestion? I will take one more suggestion before moving forward. You are in the third year, and I am also in the third year. Pardon? Jayapala. Jadi? Jadi Phala? Jadi Phala Patra? Jadi Patra. Okay, and I'll make it less embarrassing for you. This is a feature produced by chronic helminthiasis. This is a feature produced by chronic helminthiasis, and don't apply anything on the skin. Apply your mind. Okay? You give Deepana Pajana Aushadam, and when the tongue becomes clean, give Krimishodhini Gudiga. And once the worm goes off, this feature will go off. I am showing these photos in rapid succession only to condition your mind. Look at the variety. There was no, when I took this photograph, there was no power supply in my clinic, and I used a torch. Just look at the variety. There are more photos. Now, can you tell me what features you are looking for while observing the tongue? One answer at a time. One answer. Just one of you can raise your hand and give me the answer. Color of the tongue, shape of the tongue, coating, size, pattern, texture, dentation, the impression of teeth on the sides of the tongue, deviations, then thickness or size of the tongue, cracks, okay. And there is one more feature. Observe whether the tongue is, whether the surface is dry or moist. Dry or moist. Okay. Now each one of you was observing 1, 2 or 3 features in the tongue. Now you know what everybody was observing, and from this point you try to observe all these features in the remaining photographs. Try to look for all the features which you heard just now on this tongue. No talking. Try to make a quick checklist of all the features which you discussed and look at the photograph. Now, are you not observing like an expert? Okay, you are already observing like an expert. So, can I stop my class now? Yeah. There are multiple photographs of this patient, and she had been suffering from this inflammatory bowel disease for a very long time, and when she came, the cracks were multiple and deep, and within 3 months of a diet rich in coconut oil and ghee, the cracks almost disappeared. When the patient is cooking the food using other edible oils, it takes more than a year for the cracks to disappear. Coconut oil and ghee are excellent aushadas. There is one more feature which is suggestive of poor ability to conceive. This patient could not conceive. And there is an important feature. I told you that before becoming a student of Ayurveda college, I was learning many Anya Shastrani, and one of that was Samudrika Lakshana Shastra, and there is one important feature that is actually missing near her mouth. Can you identify that? Pardon? The line where? On the tongue? Between the nose and the lip. It is called philtrum. See, when the philtrum is very broad, they can conceive very easily. But here the philtrum is absent. She could not conceive. Okay? So when you are looking for one feature, the patient will be giving you two features. It is your duty to be alert and absorb all the information that is available. Look for all the features. See, now after I interpret the slideshow to get all the points on which you are concentrating, don't you feel that after you knew what to look for on a tongue, you are making more responsible and more rewarding observations? Yes or no? Now let us see, a person is very lean, the person has less of which two Buddhas? Prithvi and Jala. One person has a very big body, which two Buddhas would you expect to be more? Prithvi and Jala. Okay, now this is an association. Now try to make such an association with Prithvi and Jala on the tongue. When you have more of Prithvi and Jala in a yogi, will you expect more coating or less coating? More coating, because if the Ahara Dravyam contains more of Prithvi and Jala, the Mala produced will also have more of Prithvi and Jala. Yes or no? So naturally, the next day, those two Buddhas will be having an impact on the tongue. Okay. So now, can you associate more coating on the tongue with more Buddha in the Sharira, especially Prithvi and Jala? Yes. So if all the Buddhas are in the form of Dhatu and the Mala is very little, will you expect the tongue to be more dirty or more clean? See, in Raja Yakshma, there is very little Dhatu and lot of Mala. There will you expect to find a clean tongue or a dirty tongue? Dirty tongue. There is another person who is an Olympic champion, eating Hida Bhojanam, exercising 4 hours in a day, and no Agnimandyam, no Ama. Will you expect the tongue to be dirty or clean? Very clean. See, now you have associated more Mala with more coating, more Prithvi and Jala with more coating. But now just now you told me that maybe there is more Prithvi and Jala in the body, but if it is in the form of Dhatu, the tongue will be clean, and if it is in the form of mala, the tongue will be dirty. Yes or no? So were you not teaching me something? You said that in an Olympic champion, maybe there is more of Prithvi and Jala which helped him to get a gold medal, but his tongue will be clean because everything is in the form of dhatu. And then you said in the case of Rajekshma, there is more of Prithvi and Jala, but not in the form of dhatu, but in the form of mala, and so the tongue will be more dirty, and whereas in the case of an Olympic medal winner, it will be very clean. Okay. So were you not telling me that the coating on the tongue is more directly proportionate to the mala in the sharira than to dhatu? That was what I wanted to tell you, but actually you told me that. Are you able to realize this? This is the reason why I tell you learning is a mutual process. Okay. It is not and it is not something like something who knows something telling everything and people listening to everything. Okay. And see, we get both data as well as concept. How do we know, how do we confirm that what we are learning is correct? What is tattva? Concept. What is the awareness of tattva called? Bodha. And what is the sloka? Vade vade bhavadi tattva bodhaha. Vade vade bhavadi tattva bodhaha. It is only through discussion that you realize the depth of any concept. Okay. So never hesitate to interrupt anybody who is teaching you, because the real teacher will encourage challenges from an interested student, because a teacher knows that he or she is not perfect, and that a searching question from a good the student is a very good opportunity to correct their own deficiencies. Okay. See, what you said is actually a very sophisticated understanding in Jihva Pariksha. Whenever you have more Prithvi and Jala, you can expect more coating on the tongue, and whenever you have more Vayu and Akasha, you can expect less coating on the tongue. That is correct. And when you said that in Rajekshma, the tongue will be coated, and in an Olympic champion, the tongue will be clean, that was also an important appreciable association you made. Okay. You made this realization just 15 or 20 minutes into your first session in Jihva Pariksha. This is the reason why I told you, you don't have to learn this from anybody. If you have a good camera, you will be teaching tongue diagnosis after 1 or 2 years. Okay. You begin to take photographs. Now let us make the learning a step by step process. You have understood, you have started teaching me. Now we will go one step backwards and check whether what we declared is correct. If you go into the net, you will get lot of photographs. Okay. And some of it has been color enhanced in a computer. Okay. So the number of photographs you have is immaterial. You learn to make proper, simple, error free associations. That is correct, or that is sufficient. See, in Pitta, will you expect to find more of red or pink color? Yes. Are you able to see some pink color? So, the last component which I gave you, because it did not come from you, was moisture. Okay. So, in a Vata dominant condition you can expect the tongue to be dry. In a Kapha dominant condition you can expect slimy saliva, and in a Kapha and in a Pitta dominant condition you may come across watery saliva. Okay. And Pittam sasneham. Pittam sasneham, sasnigdha. Is it slightly moist? Yeah. If there is more of kapha, the person will be drooling. Okay. If it is a kaphaja kasa or shwasa, they will have slimy saliva which is not clear. It may look like a diluted kanji water. Whereas if it is dominated by pitta, the saliva will be clear and more watery. Here, this is also a sign of increased pitta, as you can make it from the body of the tongue. Okay. But look at the dorsum of the tongue. Compared to the previous photograph, do you have more coating? And is it increasing towards the root of the tongue? It is minimal here, and it is increasing towards the root of the tongue. See, in most cases of Shwasa Kasa, the coating on the tongue is even. The coating is the same both at the tip of the tongue and root of the tongue. If it is increasing towards the root of the tongue, it is unlikely to be on Shwasa and Kasa. It is more likely due to Agni-mandya or Kushta, etc. Okay. See, sometimes the patient may have two diseases in the body, and the features of two diseases might be superimposed on one another. Okay. If it is a pure case of Agni-mandhyam that can respond to Gandharva Hastadi Kashayam, the coating the coating on the tongue will not reach the tip of the tongue. Are you able to see that the coating is reaching the tip of the tongue? Yes, the coating is reaching the tip of the tongue. No. Yeah, see, here you are able to see clean sides. Here you are able to see dirty yellow, slimy, butter-like plaque that is reducing towards the tip. But are you able to see the clean tip here? No, the coating is reaching the tip of the tongue. Here, are you able to see a very thin coating reaching the tip of the tongue? The papillae is visible, even the yellow papillae is visible even at the tip of the tongue. The same tongue I have photographed from the front and from the sides. Okay. While observing in person, you do not have to observe from the sides, but while taking a photograph, depending upon the lighting available in your consultation room, you may have to take 2 or 3 photographs from different distances and from different angles. Okay. Now, there is the yellow, here you are finding yellow papillae without much coating, and here you are finding yellow papillae with a lot of coating where you are not able to see the papillae. Am I right? Say, for example, if the tongue appears like this on the first visit, you give Deepanapajana Aushadam, and when the mala becomes less after 1 or 2 weeks, the tongue may look like this. Okay. But here the coating on the tongue is even. Okay. So, when the tongue has a yellow even coating, I will interpret it as a pitta dominant Shwasa Kasa, and I may give Ara Godadi Kashayam. Okay. But in the first visit, because there is a yellow coating increasing towards the root of the tongue, I may decide based upon other clinical signs that even though it is a case of Shwasakasa that demands the prescription of Aragvadadi, I have to concentrate first on the intestine. Maybe the patient has Shwasakasa, maybe the Shwasa and Kasa is not troubling him much, but maybe his Agnimandyam and gas trouble or flatulence or bad breath or body odor, maybe these are the features which are which made him visit you. Okay. Maybe it is a case of chronic Shwasakasa, but the actual reason why they came to you is the disturbances in the intestine. Here I will treat it as pure Agnimandyam, give Gandharva Hastadi Kashayam, a combination of Abhayarishtam and Vasarishtam, and once there is Koshta Shuddhi, I might have found a tongue like this, and then I might have given Aragodari. Okay. But usually see my own teachers, when they were teaching Mula Siddhantam, they taught us Nidana, and sometimes they connected it with Chikitsa. But whenever they were treating, whenever they were teaching Nidana, they always connected it with Chikitsa, and only when they connected it with Chikitsa, we could make a differential diagnosis. Okay. See, maybe here we find there is not much Amatum. So, the drug need not be very Kapha Hara. Both Shwasa and Kasa are Vata Vyadi. So, I need to give have more of Vata Hara Dravyam. We know that Dashamula Arishtam is Vata Hara. Okay. Here in this condition I give a combination of Abhayarishtam, Vasarishtam and Dashamula Arishtam. Okay. Whereas if I had seen a condition like this, I see that there is no moisture on the dorsum of the tongue. Okay. Well, see, the tongue has to be moist. Okay. If the Srotas is having normal pravritti, the tongue has to be moist, but there is no moisture, which means there is Srodo Rodam or an apravrti of Srodas on the Jihva. It can come due to Kafadikya Ama. Okay. So, I have to make the drug strongly Kafahara. So, I equate the intestine with a condition called where there is Kafaja Arshas and Kafaja Kasam. No appetite, no ruji. Okay. I give a combination of Abhayarishtam and Vasarishtam 2:1. Okay. See, in Panchakarma, you sometimes give the appropriate drug, but the condition aggravates. When will this happen? When you give the appropriate drug in low dose or insufficient dose. Okay. So, whenever in Vamana and Virejana, there is a very important lesson. If you are leading to Ulklesham, you have to remove all the dosham. Okay. Okay. So, the drug that is given for Shodhanam should be stronger than the drug given for Ulklesha, because if you dislodge a lot of dosham, but if you are removing only a part of it, the person will have more of clinical disturbance. Okay. So, you can try to dislodge a little kapha, whereas we can try to eliminate all the kapha that is available for elimination in the koshtam. So, in all such conditions I always prescribe a combination of Abhayarishtam and Vasarishtam 2:1. Okay. Just think of this dosha sanchara. The dosha is circulating from the koshtam to shaka and from shaka to koshtam. Can you eliminate dosham from the shaka? No. We can eliminate dosham only from the koshtam. Can you eliminate it through the upper part? Vamanam is very difficult. Is it not easy to eliminate it through the Adomarga? Okay. Whenever there is a lot of mala in the koshtam, and when the downward movement is not happening, is that disease not called as Arshas? So, whenever you think of Koshta Shuddhi, always think of Abhayarishtam, which is indicated in Arsha Prakarana. Okay, you give this, you make it the mainstay of your treatment. You will be quickly accepted as a general practitioner. Okay, the disease is Shwasakasa. We have to break some kapha in the shaka, and there Vasarishtam is very useful. So, okay, so a combination of Abhaya plus Vasa is strongly kaphahara, and in wherever I find a dry dorsum and a heavy coating, I give this Abhaya Vasa 2:1, and when the tongue becomes clean, I give Abhaya Vasa Dashamula. These are just 2 or 3 combinations I have used for the past 20 years. And my consultation fee is 150, and people think that I know something. See, it is very easy to fool people. You correct Agni, you insist on strict Patya, and the Koshtam will take care of the rest, and you take the credit. Okay. Now I will connect Jihva with the clinical condition. See, in this condition, the patient the most valuable bits of information are actually locked in very small fragments of slokas. Okay. This is the reason why I told you, whenever you are in doubt, stick to the basics. How much time do I have? Usually when they call for a class, it is up to 12 p.m. So, it is up to 12 in the night. Okay, yeah. See, look at this tongue. See, when there is lot of kapha, and what would be the condition? No appetite. എത്ര മണി വരെ എനിക്ക് ക്ലാസ്? സാധാരണ എനിക്ക് രാത്രി 12 മണി വരെ. Minutes left. അല്ല, അത് കഴിഞ്ഞാൽ ഇവർക്ക് എന്താ പണി? 6 മണി. എൻ്റെ വണ്ടിക്ക് ബ്രേക്ക്. Okay, see, when there is amatva, I have only 20 minutes. I have Vadi Unmada. When I become hungry, I can't stop talking. See, when there is a dry dorsum, you can expect more of kapha, more of Agrimandya, more of ama, and the person will say, there is no appetite, I am not able to know the taste. If it is a chronic and Shwasakasa, they will also say, I am not able to know the smell also. Okay, in all the conditions I give Abhaya Vasa 2:1. If the person is not able to know the smell, I may give Amrutotram Vyagradi and Vyoshadi Vadagam. Okay. So here in this condition, will this person have Kadu Priyam or Madhura Priyam? The person will naturally have Kadu Priyam and Madhura Dvesha. Okay. So if there is Agrimandhyam, will the person have a craving for Amla Lavana Priyam? Will the person have Kadu Amla Lavana Priyam? In all conditions where there is Agrimandhyam, they will have Kadu Amla Lavana Priyam. Kadu Amla Lavana Priyam. In a condition like this, they will have Amla Lavana Madhura Priyam. In a once the mala reduces, they will have Amla Lavana Madhura Priyam. There is not much, there is no dominating kapha, but there is a lot of Dadukshayam, and because the mala has been eliminated, there is some space available, and the Acharya Charaka is talking about 4 modes of increase of Vata, and one of the modes of increase of Vata is sudden increase of availability of space to move about. Am I right? And it is in such conditions that we are including Masha in the Aushadam. Masha is actually Malakari, but in the treatment of Vadiga Hridrogam, Masham is an ingredient where it is given to suddenly reduce the space available, so that there is a sudden control of Vata. Okay? So, even when you have a domination of Vata leading to wasting, are you not prescribing Thailam prepared using Masha? Masha Atma Guptadi. Am I right? So, here when you see a tongue like this, you can expect, you will understand that Kapha is not dominating, and the Srotas is reasonably clear, and now the person can receive some Madhurya Rasa Dravyam. Okay? So, see for example, in this condition, can you give Ashwagandha Arishtam? Ashwagandha Arishtam is Brahmana. When the tongue indicates dryness and Amatva, can you give a Guru Dravyam, Brahmana Dravyam? No. But after 2 weeks of Deepanapajana Aushadam, if you find a clean tongue, naturally you understand that you can give Ashwagandha Arishtam. Okay. So, now were you not teaching me Chikilsa? Just now, were you not teaching me Chikilsa based on Jihva Pariksha? Yes. Okay. Here you said I should give Abhayavasa 2:1. Here you gave me permission to give Ashwagandha Arishtam. Yes or no? This is the reason why I said that teaching is a mutual process. Okay. An increase of Pitta, a component of inflammation in the intestine, and whenever there is inflammation there is Shofa, and whenever there is inflammation of the intestine, and when there is edema of the intestine, there is also edema of the tongue. Don't you find that there is a mismatch of the tongue and the size of the mouth? And whenever the tongue undergoes swelling, it presses against the teeth, and it is only in such conditions we find the impression of teeth on the sides of the tongue. And there is one important question you can ask people to understand whether they are suffering from inflammation of the intestine. The accidental biting of the tongue. We think that people bite the tongue because of hurry or lack of attention. No, usually they bite their tongue only when their tongue is swollen. Okay? But can you recollect the quoting on the previous tongue? It is reaching the tip of the tongue. Here it is not reaching the tip of the tongue to that extent, but the most notable feature is it is not extending to the sides of the tongue, whereas here it is extending to the sides of the tongue. Okay? So, here see, we know that Triphala Churnam is a good Pittahara and anti-inflammatory drug. Here will you give Triphala Churnam? You cannot come to a quick conclusion. Okay. But I will not give Triphala Churnam because I find a dry dorsum. Okay. But here I find the dorsum is not, it is slimy but not dry, and the sides are clean and very wide, and the tongue is grossly swollen, and there is tooth impression on the sides. Here Triphala should be given in a heavier dose. See, when there is more of Pitta, the body will try to eliminate it, and the person may be having 4 or 5 semi-solid watery evacuations per day. But here nobody will think of giving Triphala churnam. But here if you give Triphala churnam, the number of bowel evacuations will come down. Triphala will produce constipation. Okay. Some doctors give Triphala churnam and it leads to constipation and then they stop the drug. But if Triphala churnam is producing a constipation, it is an accidental confirmation of inflammatory component of the disease. Okay. Why is the person having loose stools? Because the inflammatory exudate is diluting the stools. Okay. And when any material comes in contact with the inflamed mucosa, there is pain which leads to increased peristalsis and increased evacuation. So here if the patient is, here actually the patient was having 7 or 8 low volume semi-solid bowel evacuations with a burning sensation in the anus. I gave Triphala churnam 3 times in a day after food, and the number of evacuations dropped to just 2 or 3, and the stools became more well formed. See, now are you able to see transverse cracks? There is a dry dorsum. Here we had a dry dorsum but no transverse cracks. Here the Vata is not very strong. Here maybe it is more chronic and Vata is more. Okay. Vayu vibhajati. So wherever there is a crack on the tongue, you with a lot of confidence you tell the patient that it will take 6 to 12 months, 6 to 24 months to correct it. Tell them that the cracks begin to appear only 3 to 4 years after the disease establishes in the body, and it may take 6 to 24 months to correct it. If they are using plenty of coconut oil and ghee, it may disappear within 3 to 6 months. But the patients won't believe you, but as long as the disease does not disappear and as long as they are able to find the crack on the tongue, they will come back to you. So whenever there is pitta, can you expect more of reddish swelling? Yes. Now are you able to see red papillae concentrating towards the tip of the tongue? The same tongue from 2 different angles. See, I said this contains pitta, this indicates pitta, but are you able to see any red papillae at the tip of the tongue? No. But usually when you find a red papillae on concentrating towards the tip of the tongue, it may be something like chicken pox, something like Visarpa. The pitta dominant skin diseases characterized by maculopapular lesions, and wherever you find a reddish papillae towards the tip of the tongue, you can expect some sort of inflammation somewhere, and the most commonest inflammation is the inflammation of the urinary tract, and it responds well to Chandraprabha. See, are you able to see the yellow papillae reaching the tip of the increasing towards the root of the tongue? Yeah. A more chronic condition, are you able to see that the sides are clean and moist, clean, wide and moist, but because of the chronicity there is Vata, but again the tongue is swollen and the tongue is crimson. See, a normal intestine will be indicated by a normal baby pink tongue. When pitta increases, there are various grades. It is very easy to understand the level of pitta from the discoloration. When the level of pitta keeps on increasing, first it is pinkish red, then it is red, then it is reddish crimson, then it is crimson. See, a very chronic inflammation of the intestine indicated by the cracks as if it has been and damaged using a chisel. Okay. Are you able to find that the coating is, see there are two strong features here. Yellow coating on the tongue, which is somewhat slimy and dry, and a concentration of red papillae at the tip. Each tongue is different if you make a keen observation. See here, is the side completely clean? It is somewhat cleaner. So you can't give a kapha vardhaka dravyam. You can't give Shidiruksha dravyam like Tiktakam, Mahatiktakam, etc. The drug has to be Ushnam or Anushna Shidam to maintain Srodo Vivaranam. If you give Shidiruksha dravyam, it will lead to Srodo Sankochanam. So when the sides are not clean, you should not give totally Shidiruksha dravyam. Okay, the drug has to be Ushnam or Anushna Shidam to maintain movement of mala in the Srodas. But when you find the reddish papillae at the tip of the tongue, you have to give either Chandraprabha or maybe Triphala Churnam. So here the sides are clean, and you can give a drug like milk. So here can you give milk? No. Here you can permit the use of milk. Let us imagine that this person has cough with sputum, but if you find the tongue is clean, you can give milk to produce Shuddha kapha. If the patient happens to work in a textile mill, if you give milk, Shuddha kapha will be produced and the dust will be eliminated through the action of the ciliary epithelium. This is yellow papillae reaching the tip of the tongue, but there is a very important feature. Can you tell me? This is yellow papillae reaching the tip of the tongue, but when the tongue was kept like this, the feature was not very evident, but when I told the patient to make the tongue flat, the feature became evident. That is the reason why I have given 3 photographs. Look at the third photograph. Are you able to see a bilateral split? Yeah, that the coating appears as if it has bilateral horn. Okay, yellow papillae, and again yellow red papillae concentrating on the tip of the tongue and sides of the tongue. So even if when I find more coating on the tongue, I increase the dose of Arishtam. What is the dose of Arishtam? 15 to 20 ml. That is for Nasyam. 1 or 2 pala, or the quantity you use for Ushapanam. Rendu reference undu. See, long back when there was prohibition, people were misusing Arishtam, and many companies were adding narcotic drugs into the Arishtam, and people were drinking a lot of Arishtam to get intoxicated, and fed up by this, the Central Excise Department started imposing strict conditions, and then medicine manufacturing companies began to print the dose of Arishtam as 15 to 25 ml, but the actual dose of Arishtam is indicated in 2 references. One says 1 or 2 pala. So it is 60 to 120 ml, and the second reference regarding the dose of Arishtam is that quantity, the quantity equal to your Ushapanam. Okay. So my dosage is always 40 to 125 ml. In the IP, we have perfect control over their dose and diet, and in such condition, if the patient is habituated to alcohol and hard work, I give up to 125 ml of alcohol. Is there a question? Yeah. One time. I believe in making people happy. Okay, see if there is, based upon the thickness of the coating on the dorsum, I will give up to 75 ml of Arishtam, but taking into consideration the red papillae at the tip, I will also give Triphala Churnam, and even if the person is suffering from Shwasam and Kasam, I will compel them to drink tender coconut water whenever they are thirsty. In Kafaja Shwasa Kasam, you can insist on water boiled with Shunti. So, if this is produced by Paitika Kasam, is it not more wise to recommend tender coconut water? Usually physicians are not bold enough to recommend this, but if you find a tongue like this, or like this, or like this, insist on as much tender coconut as they can drink. Don't say one at 11 a.m., one at 4 p.m. Drink whenever you are thirsty. This is what I said, stick to the basics. The patient should drink when they are thirsty and stop when they are satisfied. Okay. In Paitika Koshtam, they will have Madhura Priyam. In Kafaja Koshtam, they will have Kadu Priyam. Okay. And accordingly, we should advise our diet. So, here will you give tender coconut water? No. Here you can give water boiled with Shunti, but not water boiled with Ardraga. Why? Yeah, give me the Ardraga is Ruksha. What is your answer? Shunti has Madhura Vibhaga. So, it is Dipana Pachana Manulomana, but not Pitta Virodha. So, here you may give water boiled with Shunti, and in all such conditions, as you can see here, where there is clean, moist, white sides, you can give tender coconut water. Even sugarcane juice boiled. Why can't we give raw sugarcane juice? Because whenever the intestine is upset, before it can be digested, it will undergo fermentation, and then it can produce burning sensation in the intestine. So, clinically I do not find much difference between water boiled with Shunti and Ardraga. There is only a very small spectrum of condition where the water boiled with Ardraga is producing burning sensation. What is the Shodhanam for Ardraga? Removing the peel. If you are boiling it for your mother-in-law, don't remove the peel. See, a very chronic condition. See, are you able to see the wavy cracks at the center of the mid part of the tongue, along the mid axis? See here are you able to see wavy cracks concentrating on the midline, which is not evident when the tongue is kept narrow, and it is evident when the tongue is kept broad. So, whenever you are observing a tongue, ask the patient to spread the tongue so that you are able to, so that you do not miss a feature. Pure white coating. The patient was selling idli batter and using it 2 or 3 times in a day, so she was having a chronic an active inflammation in her intestine, as indicated by the ant-eaten appearance. Whenever there is an ant-eaten appearance, along with Deepanapachana Aushadam, you have to give Triphala Churnam. See, clean, moist, white sides. Okay. Here the dorsum is slimy but not dry. It is slimy but not dry. So I don't find much ama, but only kleda. Slimy dorsum, kleda. Dry dorsum, ama. Somewhat clean, but this is an indication of crimson color. Okay, it is an indication of crimson color, which was not evident in the straight photograph, but which is evident when the photograph is taken from the sides. See, this is a mild bluish discoloration, an indication of involvement of Vata. Are you able to see the bluish discoloration, bluish gray discoloration? More chronic, and the color and the depth are all more. Chronicity. See, there are various types of cracks, but unfortunately we don't have the time to go into such finer details. This was a patient with cardiac disease, with a confirmed cardiac disease. Chronic. See, usually the coating should increase towards the root of the tongue, but because of the strong inflammatory component, the coating on the tongue is missing. But in such conditions, if you give only Triphala churnam for 1 week, after 1 week the tongue will be less red or less crimson, but because of the reduction in the inflammation, the root of the tongue will be completely coated. Another type of pattern with a dry dorsum. Okay, another pattern of cracks, but with a atrophied papillae. Are you able to see the wrinkles on the lips and on the upper lip and also in the lower lip? See, we think that most Hollywood stars get the best medical attention, but most Hollywood stars have worms in their intestine. See, kleda. Husband and wife, same food, same type of coating. Are you able to see this? Bluish white, dirty bluish white coating increasing towards the root of the tongue, produced by the same food. Crimson tongue with even yellow papillae, not increasing towards the root of the tongue. So here, when you find a tongue like this, you cannot give the kashayam and arisham in the normal dose or excess dose. It should be usually half of the actual dose. So in this condition, I don't find much of kapha. So I will give abhaya, vasa, deshamula 1:1:7. I find that we should give shamana aushadam. We should give something that is balya. So I give abhaya 50, vasa 50, and deshamula 350 in a bottle. Okay, and Triphala churnam. If I give gandharvastadi, it is only half of the actual dose. If the person has a cool moist palm, it indicates a great increase of vata, and I may be giving indukandam kashayam. See, always try to connect with other features. Okay, if the condition demands gandharva hastadi, the palm will be warm and moist. If the condition demands indukandam, the palm will be cool and moist. If it is a chronic shwasakasa, the palm will be warm and dry. See, when you have slanting cracks at the sides of the heel, it indicates aragvadadi. Are you able to see the vertical cracks at the edge of the heel? Vertical cracks at the edge of the heel indicate the need for gandharva hastadi. See, central crack and anti-eaten appearance, another case of pitta. This is from the net. See, when you find a coating like this, it responds to indukandam. I don't know if I have a more clear photograph. See, this is a photograph from the net. I think it has been altered, the color has been altered using a photoshopping app. See, bluish coating on the body, which indicates Vata, whereas yellow coating on the tongue, on the papillae, indicating a strong presence of Pitta. Okay? And the strong inflammation indicated by the absence of papillae. Okay, I think I have given you a lot of data. The organizers are edgy because I am shooting my time. Okay.
Thank you, sir. Thank you for the precious knowledge which you have acquired through your years of keen observation in your clinical practice.